Dr. Doohi Lee is our guest here tonight, and we're talking about brain health, and we talk about the NFL players.
Yes.
You've had a fair amount to do with what's going on. You certainly are well-versed as to what's taking place. Kind of bring us up to date where you see things today and where we really need to be down the road.
I think one of the major things that we need to do, obviously, is not take it from the awareness of that there's injury there, now to the point of really, more in terms of diagnosis, and then eventually treating and making these people better. I mean, I think it's nice to have the awareness, but if you can't do something to help them, then, it becomes a little bit of a moot point. A lot of my work that I do here is based on a lot of the work that there's a psychiatrist in California called Dr. Daniel Amen. He's very famous. And a lot of his pioneering work was done using SPECT imaging and brain flow and things like that. So I'd like to touch a little bit upon what that all means. And SPECT imaging is it's a nuclear study. It's a different kind of a study than, let's say, an MRI or CT. We can look at a lot of different, body organs with SPECT just as well as, can do with CT. But what's interesting is that with SPECT, we're actually seeing blood flow inside the organ. So it's a little different than anatomic study. Let's say MRI or CT is an anatomic study. You see the actual brain tissue. Whereas with SPECT imaging, you're actually seeing the brain flow, which translates into function of the different parts of the brain. That's a major difference. Mm-hmm. So the studies some of the studies that he's done actually shows that almost 100%, that SPECT scan will show problems in the brain that MRI or CT cannot be seen. Very interesting. And taking that to the area of the NFL players, what's interesting is that one of the studies they've done is they took different positions, and they did a large study. It's not just a couple of players.
So you're talking about different positions on the football field, like a quarterback or a defensive player?
Exactly.
Okay.
Defensive player and offensive lineman. What was really fascinating is that in the offensive lineman, they actually had problems with brain flow in the frontal part of the brain. And frontal part, it's called the frontal lobe, really affects your executive function, decision making, and kind of higher function of the brain, planning and things like that. So they had some problems there. And the defensive lineman, which is interesting, had problems more on the temporal lobe, on the medial side, which has more to do with memory. So they actually had different areas of injury, and depending on the positions, they actually had a different kind of a problem as shown by SPECT. You can't see this on MRI, but the SPECT scan would have to show that, which is really fascinating. And one of the studies that Dr. Amen did actually was to, for the subset of football players, was to put them on a really serious, a treatment program using supplements, high-level fish oil, antioxidants, brain helpful nutrients that are specifically tuned for the brain. And he did it for 6 months. And there were significant changes in the pre- and post-treatment testing from cognitive function, memory, all the different functions that we expect brain to do. So there's actually quite a bit of hope that the brain can reverse itself, can heal. And I think that's a really important message for people to understand that, yes, you can get pretty severe traumatic brain injury, but things can be done to help you improve. And there's definitely hope. And we have a tool, that's SPECT imaging, that can actually show you differences in treatment program before and afterwards. And you can actually see the differences in improvement after treatment. A lot of disease is really behavior and lifestyle. And we have a saying in anti-aging medicine, health really is 80% what you do and 20% genetics. And we think that, I was born with such and such a gene, so I have this. Well, not necessarily true. You may have those genes, but you can kind of turn those genes on or off depending on what you do about it, okay? So obviously, if you have a history of Alzheimer's disease or dementia, yes, you can just go on and have the same kind of lifestyle and things like that propagate and increase the risk for those kind of problems. Or you can make choices that will keep you healthier and really decrease the risk significantly to developing those kind of problems. So even though you may have the genes or familial traits for those kind of devastating problems, by making the right kind of lifestyle choices and living healthy, you may not experience those, which is a really, I think, encouraging thing to do, that we have a choice in how we can be.
Are patients, for the most part, receptive to that when you tell them that information?
Well, they like hearing it, but then actually doing it,
that's another story.
That's the hard part. But people really, once they're receptive, I think they really try to make the effort because they know, well, I have a choice now of how healthy I can be, and that's really an important thing. They're not stuck in a blind alley road. So I think that's a really an important message that people need to understand.
Brain health is our topic tonight. And Dr. Doohi Lee is our guest. We're back with more after this.